Hey, Thunder Bay in northwestern Ontario. It is Sunday, the 29th of March. This is James with Net News Ledger. The Prime Minister addressed Canadians today offering information on new supports. Here is Prime Minister Justin Trudeau.
Le mois qui vient de passer a vraiment été très difficile pour beaucoup de gens. Je comprends ça. Et on fait tout ce qu'on peut pour vous aider en tant que gouvernement. Juste cette semaine, on a annoncé des nouvelles mesures pour les familles, les travailleurs et les entreprises. Mais même avec le coup de pouce, je sais que ça reste difficile. Et pour ceux qui avaient déjà des difficultés, c'est encore plus dur. Le fait de rester chez soi, par exemple, c'est pas toujours évident. For some, physical distancing means juggling taking care of the kids while trying to get some work done at the kitchen table. But frankly, that's not everyone's reality. For far too many people, home isn't a safe place to be. For others, it's somewhere they're isolated and alone. And for too many more, they have no place to go at all. Tough times fall first and hardest on the most vulnerable in our communities. But we can change that. We can make sure that no one is left without help. Let me take a moment to speak directly to kids. I know these past weeks have been tough. You haven't seen your friends, you're not able to go to school, you've been hunkered down with your parents, and you're watching the world you know change radically. It's a source of anxiety, it's a source of tension. Maybe there's extra tension in your family. But there are people who can help. Reach out to Kids Help Phone. You can call them or text them. Text at 686868 or call 1-800-668-6868 or go online to kidshelpphone.ca. They are there to listen. They are there to support you. They are there to make sure that you know that you are not alone and help you and all of us through this. No matter where you live, 24 hours a day, 7 days a week in French and in English. Indeed, to make sure that you have the help you need, we're investing $7.5 million for more counselors and trained volunteers with Kids Help Phone. There are people in your corner making sure you're okay. And kids, I want to speak with your grandparents now. Our seniors are particularly vulnerable to COVID-19. We all know that, and it's for them that so many of us are staying home, are self-isolating, are following the rules. But even if they're safe and isolated, this is not easy on them. Maybe they're having trouble getting out to get groceries. Maybe they're feeling particularly alone. Maybe they've already been isolated and this is just an extra degree of stress on them. Well, we've got help for them as well. The Minister of Seniors, Deb Schulte, is announcing $9 million through the New Horizons for Seniors program to the United Way, for everything from health check-ins to grocery delivery. In fact, the United Way is already stepping up. Here in Ottawa, they're helping people like you with things like meal delivery. Aujourd'hui, on annonce des nouveaux fonds pour ceux qui en ont le plus besoin. Je veux prendre un instant pour parler directement aux jeunes. Je sais que ces dernières semaines n'ont pas été faciles pour les jeunes. Ne pas voir ses amis, ne pas pouvoir aller à l'école, ne pas pouvoir faire les choses que vous faisiez avant. Votre monde est en train de changer. C'est une source de stress et d'anxiété pour vous, pour votre famille. Les choses sont peut-être pas super faciles à la maison, mais sachez que vous pouvez avoir de l'aide et vous n'êtes pas seul. Jeunesse, j'écoute est un programme qui est là depuis longtemps pour aider les jeunes. Vous pouvez appeler, vous pouvez aller en ligne, vous pouvez texter aussi. Ils vont être là pour vous aider. Envoyez un texte au 68 68 68 ou appelez au 1-800-668-6868. Peu importe où vous êtes, en français ou en anglais, 24 heures, 7 jours par semaine, il y aura quelqu'un là pour vous aider, pour aider votre famille. Et pour faire plus pour aider ces jeunes qui ont besoin de parler à quelqu'un, On investit 7,5 millions de dollars dans Jeunesse J'écoute et leurs intervenants. Et pour les grands-parents de ces jeunes, on pense à vous aussi. Ça fait longtemps qu'on dit que la COVID-19 frappe plus fort et est plus un danger pour nos aînés. Alors, vous êtes très probablement encore plus isolés que vous l'êtes souvent. Vous avez peut-être de la misère à faire vos emplettes, de la misère à pouvoir subvenir à vos besoins. Mais je veux souligner qu'on va envoyer de l'aide additionnelle pour vous aussi. Pour aider les personnes âgées vulnérables, on offre à Centraide 9 millions de dollars grâce au programme Nouveaux Horizons pour les aînés. Ça va permettre à l'organisme d'offrir tout un éventail de services aux aînés, que ce soit une vérification de leur état de santé ou un service de livraison pour l'épicerie. Dans un pays comme le Canada, personne ne devrait être laissé pour compte. Et pour aider les personnes en situation d'itinérance et celles qui fuient la violence familiale ou la violence fondée sur le sexe, on a alloué 200 millions de dollars au refuge. We promise to help everyone get through this tough time. If you can't go home because it isn't safe or because you don't have a home, we're not going to forget you. We'll work with the organizations you rely on, and we'll have your back. Earlier this month, we committed $200 million for shelters. If you need to get away from domestic violence or violence because of your gender, if you need somewhere to stay, there are places you can go and be safe. This new funding is already having a huge impact on support for you. Just take the shelter in Toronto that can now rent additional space to isolate residents with COVID-19 and keep everyone safe. And we're going to keep working with charities and nonprofits on this. On that note, I want to recognize the incredible people who work and volunteer in their communities through these groups. I know it's been hard lately, not just because more and more people need your help, but because you're struggling to keep doing this work for marginalized and vulnerable people during a public health crisis on a scale that Canada has never before seen. Soon, I'll have more to say about how we can make sure you're supported and can help keep helping Canadians who need it most. But the bottom line is this: whomever you are, whatever you need, we're here for you. And if you're fortunate enough to have a little extra to spare right now, I'm asking you to join in and be part of the solution. Please donate to your favorite organization or find out how you can volunteer in your community. Even working from home, you can make a real difference in the impact an organization can have. As an individual, a family, a company, think of how you can lend a hand to help others through this tough time. On a tous notre rôle à jouer pour assurer notre santé et notre sécurité. Comme on le répète souvent, c'est très important que les gens continuent de garder une distance de 2 mètres avec les autres, de rester chez eux et d'éviter les endroits achalandés pour aplatir la courbe le plus rapidement possible. Je sais que c'est encore plus difficile de rester à la maison pendant la fin de semaine. Par moments, on peut se sentir très seul. Mais n'oubliez pas qu'on est tous en train de traverser cette épreuve ensemble. Il ne suffit que de regarder autour de vous pour voir des signes de solidarité. À travers le pays et à travers le monde, les gens affichent des arcs-en-ciel pour rappeler à leurs voisins que nos meilleurs jours sont devant nous. Et si vous êtes à Montréal ce soir, regardez le pont Samuel de Champlain. Il sera illuminé avec les couleurs de l'arc-en-ciel. I know these are hard times, but I also know that we're going to get through them together. Merci beaucoup tout le monde.
Thank you. We'll now go to the phone lines for first question. Please keep it to one question and one follow-up. Operator?
Thank you. Merci. La première question nous vient de Raymond Fillon, TVA. À vous la parole.
Oui, bonjour, Monsieur le Premier ministre. J'aimerais vous amener sur un autre sujet. Est-ce que vous avez reçu une ou des demandes jusqu'à présent, ou est-ce qu'il y a des discussions pour de possibles interventions des Forces armées canadiennes quelque part au Canada? Je pense notamment au Québec, où il est question possiblement au cours des prochains jours de fermer l'accès à la ville de Montréal?
Nous savons que cette situation évolue constamment et nous sommes prêts à toutes sortes de différentes éventualités. Évidemment, les Canadiens savent très bien que les membres des Forces armées seront toujours là pour aider quand le Canada en a besoin, seront là pour servir. Mais pour l'instant, on n'a pas eu de demande spécifique par rapport à ça. Il n'y a pas de plan à ce moment pour effectuer des opérations au Canada avec les Forces armées.
And a follow-up, right?
Vous avez dit vendredi, par ailleurs, que vous comptez demeurer chez vous, même si vous et votre famille êtes maintenant tous en bonne santé. Est-ce que c'est seulement pour donner l'exemple? Parce qu'il y a bien des gens qui disent, vous êtes quand même chef du gouvernement du Canada. Est-ce que vous pouvez vraiment être aussi efficace pour diriger le Canada en temps de crise en faisant du télétravail?
Évidemment, nous sommes très, très contents que Sophie a été donné le feu vert. Ça fait plusieurs jours qu'elle n'a pas de symptômes et elle est allée à Harrington avec les enfants. Moi, je continue de travailler d'ici, comme on a demandé à bien des gens de le faire. Mais si vous y pensez, j'étais dans la même maison avec quelqu'un qui, jusqu'à il y a quelques jours, avait la COVID-19. Et donc, le décompte va continuer parce que j'aurais pu théoriquement l'attraper il y a à peine quelques jours. Alors, je dois continuer de rester en isolation. C'est quelque chose que Santé Canada nous recommande. Mais évidemment, c'est quelque chose qu'on demande aux gens aussi de faire, de rester chez eux quand c'est possible. Et comme vous voyez, je continue de travailler à tous les jours de la maison. On arrive à coordonner et à faire le travail nécessaire.
In English, sir.
Okay. First of all, I'm very happy, as many people were, to see that Sophie has been given the all clear. It's been a few days since she's been symptom-free. And obviously, I want to thank everyone who's sent messages of support. She's taken the kids to Harrington. I'm going to continue to stay here to do the work that needs to be done. And if you think about it, people are wondering why I'm still in isolation. Up to a few days before she was clear, I was still sharing a roof. We were being careful, but sharing a roof with someone who'd tested positive for COVID-19. So I have to continue in isolation in order to be sure that we're following all the protocols and the recommendations by Health Canada. The work that we're doing continues as a government. There are lots of companies and organizations around the country who are discovering that you can do an awful lot of work via telephone, via video conferences, and that's exactly what I'm doing, and I will continue to do it as so many Canadians are as well.
Thank you. Next question, operator.
Merci. Thank you. The next question is from Mia Rabson, the Canadian Press. Your line is open.
Hi, I'm wondering if you could talk a little bit more about what aid and help you will be providing to charities. I know several hundred of them made a plea last week for help to be able to continue. I think you hinted that there is something coming. Can you give some more reassurances that the charities that are being so relied upon right now will get some help?
Today we have announcements for charitable and nonprofit organizations specifically that have been doing a great work helping out our youth and our seniors, but we recognize there's much more to do. Not only are organizations in the charitable sector and the nonprofit sector doing incredibly important work during very difficult times, they're also in many cases seeing their donations dry up and are very worried about their capacity to continue to do the work they're doing. That's why we're working closely with them, and we'll have announcements to make in the coming days about how we're going to ensure that they can continue to do this incredible work that is so important for Canadians.
And a follow-up, Mia?
Yeah, I'm also wondering, are you concerned at all that you're putting too much pressure on airline staff, check-in staff, people at the train stations to screen people for COVID-19?
We already know that an awful lot of people are not traveling, have listened to the recommendations to stay home, to avoid non-essential travel. This is extremely important. And from the very beginning, we told people that if you have COVID-19 symptoms, you need to stay home. You should not travel. You must not go out. That's going to continue to be the instructions we give, but we've also asked airline and train staff to ensure that nobody with symptoms boards their planes or trains.
Thank you. Next question, operator.
Thank you. Merci. Next question. Prochaine question. Lina Dib, La Presse canadienne. À vous la parole.
Oui, bonjour, Monsieur Trudeau. Pour continuer sur ce même sujet, vous dites que vous n'avez pas besoin de l'armée pour l'instant, mais est-ce que vous pouvez vraiment ne pas entrevoir que très bientôt, ce serait une aide utile et nécessaire quand on voit ce qui se passe au Québec, qui a fermé un gros morceau de la province et ça prend des gens pour intercepter ceux qui continuent à se déplacer?
Les membres des forces armées seront toujours là pour aider les communautés et les gens qui en ont besoin au Canada. On est très près, on regarde différents scénarios par lesquels ce serait important d'amener cette aide supplémentaire. Mais on n'est pas rendu là aujourd'hui. On va continuer nos discussions avec les provinces, avec les différentes régions du pays pour s'assurer qu'on puisse faire ce qui est nécessaire au fur et à mesure. On ne ferme pas la porte à tout scénario, mais on est en train de prendre les décisions au fur et à mesure.
Et ma prochaine très, très courte, est-ce que je comprends qu'on commence à compter vos 14 jours à partir d'aujourd'hui, maintenant?
On va continuer de suivre les recommandations. Je pense que c'est une façon de le compter, ou même peut-être quelques jours de moins, parce que ça fait quelques jours que Sophie a plus de symptômes. Mais on va vous garder au courant de combien de temps on va continuer de faire les conférences de presse ici.
Thank you. One more call. Operator, please.
Merci. Thank you. Next question, Alex Butler, Toronto Star. Your line is open.
Good morning, Prime Minister. You announced a whole lot of different, funds and measures for small businesses, but a lot of small businesses are having trouble navigating through what you've announced in terms of tax deferrals, wage subsidies, credit availability, that sort of thing. Groups like the CFIB are trying to help them navigate this, but are you considering anything from the federal government to make it easier for people to access the funding that they can access and getting the funding to the right people?
We are doing an awful lot of things that have never been done before by any government in this country. There's never been a reason to. And as we're developing new policy solutions, new ways of helping out people so that we can get through this time and come out the other end of it stronger than ever before, we need to really figure out both what those things are and to ensure that people are going to be able to access them. We are putting out as much information as we can about the different options, and I recommend people go to Canada.ca to be able to find more information about it. I know there are organizations, whether it's the CFIB or banks themselves, that are giving advice around these new measures we're coming in, but we're going to continue to communicate as best we possibly can so that everyone is able to access the help that's there for them, even as we create new ways to help people. I recognize the challenge, and we're going to continue working on it.
And Prime Minister,
je reconnais que c'est juste une seconde, Alex. Je reconnais qu'on est en train de faire énormément de choses nouvelles. On a des nouveaux programmes et ça peut être bouleversant d'essayer de trouver exactement comment obtenir l'aide qu'on est en train d'envoyer. C'est pour ça qu'on va continuer d'essayer de donner toute l'information nécessaire aux citoyens, aux entreprises pour pouvoir accéder à l'aide qu'ils méritent. En même temps, on va continuer de travailler avec des organismes et même des banques pour s'assurer que l'information sur toute l'aide qui est disponible soit accessible pour les gens qui en ont besoin.
And your follow-up, Alex?
Prime Minister, there have been numerous reports that prisons are of particular concern. Prisoners are concerned about the measures in place to protect them from the outbreak if it reaches prisons in Canada. Well, what do you say to prisoners who are concerned right now that they're dealing with 1 bar of soap per week and no other countermeasures.
We are very concerned about the fact that our correctional institutions could be places where there could be greater vulnerability to COVID-19. That's why we've been working very closely with Corrections Canada, and I know Minister Bill Blair, Public Safety Minister, will have more to say on this. This is something that we are digging into very carefully because we need to make sure we're keeping everyone safe in this country. Je reconnais que nos institutions de Correction Canada sont plus vulnérables que d'autres endroits à COVID-19. Donc, nous allons continuer de travailler avec le Service des Corrections Canada et le ministre Blair pour assurer qu'on est en train de faire ce qui est nécessaire pour garder tout le monde en sécurité.
Thank you. We'll now go to questions in the room.
Ian Wood, CTV News. Prime Minister, this morning you made a small announcement with regard to seniors giving money to charity groups there. But what about those that are on fixed incomes, seniors who have watched their investments and their retirement savings dwindle away on the market? Are we going to see any increases to CPP or other provisions for them like you've offered to workers and small businesses?
Our focus right away has been figuring out how to ensure that we can replace sources of income and revenue that have been lost because of COVID-19 for so many Canadians across the country who were relying on their paychecks to get through from week to week until this actually hit. But we recognize that seniors are facing greater vulnerabilities, and we are looking carefully at measures to be able to support them through this tough time as well.
Okay. And the Dutch government has sent back 600,000 masks to China that they deemed were defective. I'm wondering, when will we receive the masks that China has said they're going to send to us, and what assurances do we have that they will be effective? And have we seen a thaw in our relationship with China in the course of this crisis?
We will be receiving equipment, masks and gloves and gowns from China extremely shortly in the coming days. And at the same time, I can assure people that Health Canada has very strong procedures for evaluating, for ensuring that what we get is up to the necessary standards, and there will be no corners cut on this one. We need to make sure that the equipment that our healthcare workers rely on to keep them safe as they keep us safe is of a quality that is going to actually do the job. And we're going to continue to engage with the world and try to work collaboratively through this difficult time. It is a global pandemic, and countries need to set aside their differences and work together to get us through this as best possible, and that's certainly the approach that we're taking.
Abigail Beeman, Global News. Prime Minister, in the case of the Quarantine Act and also in the case of the measures announced for travelers yesterday, there's been no clear information about enforcement for those who break the rules. And yesterday in Ontario, we saw a snitch line for price gougers. I'm wondering if you can provide more information about enforcement in general, and also wondering, are you encouraging Canadians to report other Canadians who aren't following the rules to local authorities?
I think, first of all, it's really important that we all follow the rules. What we do today, what we've done over the past few days, what we will be doing over the coming days will have a direct impact on whether or not Canada is able to make it through this crisis in the best possible way. It'll have a direct impact on our healthcare workers. What we are choosing to do right now, these weeks, will affect deeply whether and how we get through this crisis and get out the other side better. So I really impress upon everyone the need to self-isolate, to follow the rules, to make sure that we are not putting ourselves or our neighbors or our communities at risk. Health Canada does follow-ups with people in terms of respecting quarantine. That's an important part of what we do. And I would really encourage Canadians to continue to spread the message, share with each other how important it is to continue to stay home.
I'd also like to ask you to respond to reports that we're hearing about how truck drivers deemed essential workers are being treated when they cross the border, not having access to washrooms or restaurants, and some just being made to stay in their trucks.
We are very concerned with the need to continue essential services, and that includes obviously supply chains that are so important for keeping people fed, keeping people with the medications they need through this difficult time. We continue to work with folks at the border to ensure that the smooth flow and respectful support for these essential workers happens at the same time as we're ensuring safety for our citizens. It's always a challenging balance to establish, but we need to keep working to try and make sure that we can continue to get these essential goods while people are taking risks by continuing their essential work.
Bonjour, Monsieur le Premier ministre. Christian Noël de Radio-Canada. J'aimerais revenir sur ce que vous avez dit 2 minutes concernant les scénarios sur lesquels vous travaillez avec l'armée, notamment pour l'île de Montréal. Est-ce que vous pouvez être plus précis sur les scénarios sur lesquels vous travaillez et puis pourquoi vous y travaillez?
Depuis le début, on se prépare à différents scénarios. Où la COVID va frapper beaucoup plus fort que ce qu'on voudrait, où ça va beaucoup mieux, où différentes régions ont différentes difficultés. Je peux vous dire que nos forces armées seront toujours là pour aider les Canadiens. Je sais qu'ils avaient déjà des scénarios d'aider en cas d'inondation se prêtant. Ils sont souvent là pour faire ça. Nous allons continuer de travailler avec les autorités régionales, provinciales, avec la Ville de Montréal, avec toutes les villes à travers le pays pour répondre à des situations d'urgence qui pourraient subvenir. Mais on ne va pas avancer d'hypothèses avant d'être au moment où on devrait être amené à faire des étapes plus grandes ou plus graves. Nous allons prendre ça un jour à la fois tout en préparant pour toutes sortes d'éventualités.
Et sans parler spécifiquement de scénarios précis, puisque vous venez de dire que vous ne voulez pas en parler, est-ce que ça s'appliquerait seulement au Québec ou est-ce qu'il y a d'autres provinces qui sont en conversation avec vous pour l'utilisation de l'armée?
On va toujours répondre à tout besoin qu'une province aura s'il demande de l'aide du fédéral. Mais je ne veux pas m'avancer sur quelle province pourrait le faire ou pourrait pas le faire. On va être là pour subvenir aux besoins des provinces et des Canadiens pour nous garder en sécurité pendant ces moments exceptionnels et difficiles.
Thank you. We have time for one more question.
Ashley Burke, CBC News. Prime Minister, there are towns and there are cities across the country who are preparing arenas and community centers to prepare them into makeshift hospitals if needed. What does that tell you about where we are in the arc of this crisis? And as well, what does it say to Canadians about their hospitals' capacity?
I think it's a message that we are preparing for every eventuality. We are hopeful that the behavior that people have engaged in will keep numbers to a manageable level of people affected who need hospitalization, and that is why we are working extremely hard to encourage everyone to stay home and to not risk spreading this virus further. That is how we will control the spread. Our healthcare systems are designed to function close to capacity in normal situations. Day in and day out, we need our hospitals to be able to handle normal surges, whether it's during flu season or after an accident or an illness. We have a health system that works pretty well to handle the needs in regular times. These are not regular times, and therefore it is appropriate and necessary that we look at how to expand our health system to handle unprecedented numbers in an unprecedented crisis. And I want to commend all the people who are looking at alternatives that we all hope we won't need, that indeed we will not need if people continue to take seriously the directives and stay home and self-isolate. But it is simply responsible for us to be thinking about worst-case scenarios and preparing for them just in case we do need them.
There's been a huge wave of snowbirds and spring breakers returning to Canada, and there's a potential that we're going to see a surge because of that. How prepared is Canada's healthcare system to deal with that surge?
This is why we are impressing upon everyone how important it is that if you return from travel, that you isolate for 14 days. It is extremely important that everyone isolates. And there have been a few questions recently about, well, does that mean I can go for a walk if I keep separate from people by 2 meters? It's very simple. According to Public Health Canada, you can go for a walk unless you have tested positive for COVID-19, unless you have symptoms of COVID-19, or unless you have returned from overseas or outside the country within 14 days. And when you do go outside, make sure, if you don't have any of those three categories, make sure that you are keeping your distance. Don't gather in groups in parks. Keep those distance. And if you are in quarantine or self-isolation and you need some fresh air, open a window or step outside onto your stoop if that's a private place. But really, we need people to be abiding by the rules that public health has put out, particularly people who've returned from travel outside the country.
But can the healthcare system actually deal with the surge?
We are ensuring that we're able to deal with this surge. People are putting emergency measures in place, but we are hoping that there won't be a surge because we have seen other areas overwhelmed, even if they have strong healthcare systems. That's why it's so important that everyone abide by the instructions given. Merci tout le monde. Bonne journée.
If you found this video helpful, hit that subscribe button, hit that like button, share this video, and keep up to date on what's going on.